how we're beginning to change foods in the schools, hopefully in the hospitals, and begin to really, people have not been aware until now about how what they eat affects their health and how they feel. So I think that's an important beginning.
That's good. Now, we also talked a little bit about culture and global perspective. And I'd like to ask you how we could see, how you see this being implemented in other cultural healthcare models.
Well, I think I mentioned earlier that the epidemics we see here are on the rise everywhere, and it's just a matter of time. And at the same time, 80% of the world uses traditional healing practices that are part of their culture and belief system. As a matter of fact, the UN, the World Health Organization, last month for the first time has ordered that there's a global survey of indigenous healing modalities and practices, and then to start looking at, and epidemiologically and in research of the effectiveness. I mean, more than 25% of the pharmaceuticals we use come from herbs and plants in other cultures, and they're using it in the raw form directly and having incredible results. And we've been incredibly ethnocentric in saying that our way is the only way. And I think part of what's happening globally is a combination of the best of Western medicine combined with honoring and studying the best of indigenous healing. And I think we're going to see hopefully more of that in the future.
And just prior to coming to University of Miami, I was at University of Maryland for 9 years, and I managed a program called Families on the Move, where we educated children at the grade school level to become peer educators as well as family educators. So what we did was empower them with education based on physical activity, nutrition, and also respectable interaction between others, family members and friends. And we utilized this to have the children bring this information home and engage their family in physical activity and understanding good eating habits. And I left at a point where I didn't see much data coming back, but anecdotally I saw a movement with children who lived in inner city Baltimore, moving through a peer educator process, empowering them with this information. And you know, when I was driving home, sometimes in the evening, I worked at a school-based clinic 2 afternoons a week, and mothers were walking to school to pick the children up, and they were walking home. And it may have happened continuously, but to me it became more apparent that there was more involvement with these children and their families, and how that may be a missed segment of the population in terms of how we could start even that early to socialize and engage young people and moving forward from a peer educator process.
Great. Well, I know we've learned a lot this afternoon from our panel on the value of integrative healthcare. Are there any final questions that anyone has from the audience? Because if not, I have one final question that I'd like to see the panel address, each in turn. We've talked a lot about what's out there, what it is, what the different modalities are, but just give me a closing snapshot from each of you. What do you see happening, and what will integrative healthcare's biggest contribution do you think will be to healthcare over the next few years as we enter this area of healthcare reform?
I think we're going to look more so at the patient's perception, following the patient's beliefs and ideas, and how they want to move forward in their treatment in a collaborative effort with their healthcare providers. I think that's going to be the strongest element in integrative healthcare to put forth to the population. It's empowering the patient.
Maybe we should write a little piece on a piece of paper and put it in a time capsule and dig it up a year from now.
Well, looking forward in the future, I think we're going to look back at this time as a point in our healthcare that really led us to have to go back to a much more humanistic, caring model. And I think that we're going to see the new doctors and nurses of the future being able to have this as part of their toolbox. that they can use, and having a team and a staff that they can draw upon and really provide the best quality of care. So I'm hopeful.
So
that
we're at the
we're-
beginning of something tremendous.
This is a turning point. I really believe so. I think it's reached a cultural level where this is what is both the consumers want and this is what practitioners want. We all want to get back to a more caring model. I mean, that's why there's so much burnout amongst doctors, nurses, and anyone else that's having to work in the system today. So I wanted, just as this is our closing, thank the University of Miami for the vision and moving forward with this, because I think that it's really very needed in our community. What do you think?
Okay, I'm gonna my closing statement is a quote from Plato that, let me, just in case, okay, that it says, the mistake that physicians make all the time is when they want to treat a patient, they want to separate the body from the soul, when in reality, it's just one. And he said that many years ago. And today we're in a room trying to make that alive again.
That's great. Again, I would really like to thank our panel members. I would also like to thank all of you for the tremendous response and coming out here, for your excellent questions, and your interest in the whole issue of integrated healthcare. So that concludes our panel discussion today. And on behalf of the University of Miami and the School of Nursing and Health Studies, both faculty and students, thank you for joining us. And I hope you have a wonderful rest of the forum and really learn a lot from what. Thank you.
I'm going to do that now. Is it better? 2 minutes ahead, so I should go.